It is 6:01 p.m. and Gail Weiss here.
Dan Campbell's here.
Bernie Parada is here.
Lindsay McCarthy's here.
Robin Vandermatt.
Okay, we've got the fire department up first, and if you can introduce yourself when you come up into the microphone, that would be great.
Fire Chief. Mike Quinn, Assistant Fire Chief.
Okay, thank you. Well, have at it. Yeah, just let us know what's going on.
Okay, so the fire department budget, we kind of had a last minute change in that, and that is on the item where it says fire department / other purchases.
Yep.
Actually, let me start right from
Sure.
Let me start right from the top.
Yes, that went up.
Obviously, the stipends are the salaries for the chief and all the officers. And these numbers were put in, I believe by Andrea, as far as the percentages of increase. The same thing with the fire department wages. That increase was a percentage that was brought forward from the select board. The fire department inspection account, level funded, 3,500. Fire station electric, level funded at 8,500.
Say she's present.
Oh, 1 second.
Yes.
Morgan
means.
came in at 6:03 p.m. and then just introduce yourself.
Hi, I'm Morgan O'Brien.
Okay.
I'm present.
Thank you.
And I am here. Thank you.
Thank you.
The next item was heating oil, where our heating oil went up last year. I bumped it from 9,000 up to 10,000, so that's an increase in the heating oil of about 1,000. Propane, which is for the generator, level funded at 800. Hydrants fee is 7,600. That's level funded again this year. Fire station maintenance, which does repairs and whatnot for the fire station. We expended a little bit more than what we had figured for the last year. So I bumped that $300 up to $1,800. Fire station other purchases level funded at 1,200. And the fire department other purchases originally was 14,500. Was an increase of about $1,000. As you can see, we expended 13,000 the last year. What came along was the fire reporting system that we've been using for several years, which was called MFRS, which is Massachusetts Fire Report Incident Reporting System. That stopped and was halted January 1st. So there's a new reporting system, which is called NERIS, which we've gone to training on the new national incident reporting system, where all the data goes in at a national database. But we have found out that our old company, which was Firehouse Software, which we did our fire reports through, they went through some revamping, and their reporting system is a little bit, considerably easier than going directly into the national system. There's a lot of particulars on the national system that they're concerned about, because all the fire reports are actually public documents, and you have to be very, very concerned as far as what information goes into the report. So when we talked with Firehouse, who is owned by ESO, they offer the service to do our fire reporting through them. The other thing that they do is we have to keep all of our fire reports either in the cloud or hard copy. And Firehouse is going out of that is being phased out. So ESO, along with doing the nearest transition for us, we'll be bringing all of our fire reports over. And so we'll have them captured and stored on ESO. So that's a $2,000 increase in the operating budget. So it goes from 14,500. I bumped it $2,000 for the upcoming year.
So that's gonna be an ongoing thing, you probably
That
have
will
to
be
pay
an
per year?
ongoing thing.
Maybe we,
Yeah, in
just-
ES, yes.
okay, I'd just, maybe create a line item just for that, because if it's a,
Well, I'd like to, and I'm not sure, I'd like to revamp the way our budget is laid out here,
Okay.
because it's very hard to discern exactly what goes where. I'd really like it, I would really like it in the consultant that we have hired in to help us come up to the 21st century as far as our incident reporting. Before I get off from ESO has other modules that you can, the good thing about ESO is you don't have to buy the whole package. You can customize what you want to have them help you with. So there's other things through ESO that I think down the road we'll be getting involved with them. So this will be an ongoing cost. So that took that item from 14,500 up to 16,500. We're actually doing an onboarding training with ESO tomorrow. So we've done some extensive training on it. We're actually going to be going live after tomorrow. So that was an unexpected increase. And telephone level funded at $450. Postage level funded at $150. Office supplies, we bumped that from 600 up to 1,000, which is a $400 increase. Fire department and other supplies level funded at 7,500. And gasoline, I'm not sure what the anomaly is here, but we only have one vehicle now that runs on gasoline. So
And some small engines.
small engines in our small engines. So I decreased that from $1,000 down to $650, which is a decrease of $350.
Plus, we're also using the new town Wex card,
Yeah,
which is actually like $1 less a gallon than
Yeah.
going to Dead River.
yeah.
oh, okay.
Oh, okay.
Good.
We go up to Chaw's
So
and
this-
get our gas. It's,
Oh, okay.
Yes,
And they have
that's-
they have
that's-
diesel up there? I
They
didn't
do,
know-
but we get diesel through the town's contract.
Oh, okay,
We have our own
okay.
diesel tank
Oh,
out back
okay.
that's tied in with the highway
Yeah.
department. We keep track of that, but gas, we just go up there now. It's like literally $1 less
Up there,
Yeah.
up to Chaw's
Oh, yeah.
than what we were doing with Dead River.
And for our small engines, we're buying non-ethanol.
Up at
We
Coolidge.
found
That's
that
not what they are up there.
that's
Gotta
kept
go to
our
Coolidge for
maintenance
that,
down
yeah.
considerably. So on all of our small engines, which are chainsaws, ventilation saws, portable pumps, all that small gas equipment, we went to the non-ethanol
In the boat.
in about a year and a half, 2 years ago. We were having carburetor problems. We were having some real issues with a lot of our small engines. And since we've gone non-ethanol, that's gone away.
Interesting.
So that was a big help. Diesel, level funded at 4,500. This is like Michael said, we share the diesel with the highway.
And EMS.
Yeah, and EMS, yeah. Fire station repairs, level funded at 2,000. Fire ponds, level funded at 3,000. The FERCog radio assessment, I left it at 4,500 because they're not sure. They may have to extend a little bit. We went over to the 800 system. We're still using the 400 system for paging, and there may have to be some improvements in the infrastructure on that. So I left that at 4,500. Fire department dues level funded at 8,000. Other level funded at 500, and fire department hose and equipment is level funded at 12,000. So the total increase for fiscal year 26, 27, instead of 4,154, it's $6,154, the $2,000 increase for the ESO reporting system.
Okay, any questions from anybody?
Go ahead.
You got any questions, Dan?
No.
Okay. I agree with Dan Campbell. You need to have a line item broken out in your budget, and obviously your consultant had met that for IT. It should be specific.
Yeah.
Shouldn't be under other purchases. That's too generalized
Yeah.
to do that. The other thing is, it's kind of a sore point. No line item for training again. We asked you.
You asked me.
Yes.
Yes.
This is now 2 years now I've asked for that, and you're not compliant.
Okay.
For liability and for the importance of transparency, it should be a line item for training. There are expenses involved, there are hours you have to pay people, and you can't just say we're not paying anyone and not have a line item for
But we're
training.
not.
But, yeah.
We don't take money for trainings. That's part of the gig.
But
here.
there's expenses involved too in training.
We
You
do
tell me that
we do a lot of it
certifications,
in-house.
paperwork, software you might need for training, all these, you don't have any costs?
Yeah.
So they are doing a study, correct?
Huh?
The study that they're doing,
Yeah.
is that in the study that about training?
Yeah, training is part of the study.
Part of the whole
Okay.
study.
The
Okay, so
the only expenses that we have in training is, at this point, is the manuals that we have purchased, and that just it's been very small. It's probably been less than $500 a year for the IFSTA manuals that we use as a guideline for the training program. We discussed it, and I say we discussed it. There's and part of what the consultant and I am working on is we are a call volunteer department, okay? And yes, we are paid we're paid an hourly rate when we are on an emergency call. But there's a lot of duties that are required by the firefighters that they're not paid for, and we have discussed getting paid for trainings, and they opted not to. The membership opted not to. They said they didn't need to be reimbursed. This is part of what their volunteerism is. So,
what happens if that goes away, though? Is there anything in place that you guys are training within the department? Is that what I'm hearing? And buying
Yeah,
all the
what we-
manuals and training within the department, which is, to me, is great. But what happens if, for some reason, that option goes away? Is there anything in place to
Then there-
offset that?
then there would have to be a line item
Okay.
to cover training.
Okay.
But there's
We
also
can-
options through DFS that don't cost anything.
Okay.
Yeah.
I think
A lot of stuff through
not
DFS.
understanding that and now having it explained to us is
Yeah.
great. But
Yeah.
I'm worried about not just. I have faith in you guys right now, but if something happens to the organization for some reason, I'm looking at hopefully there's a fallback for that. So
Yeah.
The issue of
We-
liability,
Yeah.
because they're gonna say, look at your budget and say, you have no costs at all for training, when EMS is cost for training, police
Why
have
compare
costs
us
for
to
training.
another
Yeah,
department?
yeah.
Why do we have to be like another department?
Wait a minute.
I think that's only fair.
Well, but
You're a
so
public
let me. I want to say one thing. The members of our department, all full members, are residents. They are taxpayers to this town. Every dime that we spend on this budget directly comes back out of our pocket because our taxes are going to go up. We raise our budget, our taxes go up. We are extremely sensitive and responsible to that. We don't want to pay any more taxes than we have to. If we can volunteer our time and not have to be paid to do things, we will do it because we don't want to have a big budget. We don't want to compare ourselves to other departments for that. We are unique. We all live in town. Every single one of us.
That's not what I'm asking.
No.
But that is exactly what you're asking.
No. This is
I'm
this is what.
talking
Hold on.
documentation
Hold on. Hold
and
on.
liability.
Okay, documentation
Is there.
Documentation is there. All
That's
of
what I
our-
was asking
All
for.
of our trainings
Certification
are
is
recorded,
there.
Any certifications are recorded. We just went
Okay.
through first responder training,
Okay.
2 nights to get.
I think
to
that's-
get our
I think
first
that's all-
responder. That documentation is there. It is being done. Attendance is being taken care of. In any certifications, whether it's either through the Department of Fire Services or in-house training. We have a monthly training in-house. That is all documented on not only what the training was, who it was done by, and like if we're using this IFSTA manual,
Which I think is
that
great.
documentation, and as part of our, it's included in our ISO rating.
I think as long as we have the information and documentation and certification that is up to date,
Yeah.
how you get there as far as that, as long as,
Right.
is it, I mean, does a third party come in at any time to verify the certification?
No, there's no need for it. There's no
There's no
requirement for it.
Okay.
No, but it is part of our ISO rating, and it is reviewed by the Insurance Services Office.
And
And they have accepted what our training program is.
Yeah, so it's a little different than, say, you know, like police have to go through specific training and go through classes
Completely different.
and that, and volunteer with the proper people, getting the proper education works. However, I would just want to have something in place and something, you know, somebody starts questioning it. If you, and I'm not questioning it. If you have the documentation, if you have the certification, just make it available that if somebody ever questions it,
Yeah.
it's available.
Yes.
Just out of curiosity,
Yes.
I know you probably don't have a very specific number. What is that training on average costing you guys out of pocket, whatever?
Nothing.
I know you
Well,
guys
it
are
is some
donating the money for the
manual.
training.
Are you? So are you asking like
Well, you're saying
if we give like in volunteer hours?
nope the actual training pieces where you say you guys are happy to pay out of pocket. What is that average yearly expense ballpark?
You know, we do a lot. We do most of our stuff in house. We just paid Donnie
Done.
to
It's
do
probably
our
less than $500.
to do our first responder and CPR recertifications. But that comes out of our
operating.
Yep.
operating budget. I mean, that's part of
We could-
that.
We could break that out into
Okay,
the training.
we have a question in the back here.
It's not a question, it's a comment. Skip, and like, since, we're going through the consultant report tomorrow, and Skip and I had talked about breaking out account things, I actually do think that a line item is helpful, even if it's like 500,000 bucks, whatever, for the materials and all of that. Because this discussion happens every year, and you guys are in fact doing some training. And if you're paying somebody, then just have the line item for it that has the materials, even if it's a relatively small amount. This is what Skip and I were talking about, is the other things land in the other purchases
Yeah.
account line, and that's confusing, and it brings up questions every year. To have a discussion that I think you guys are actually doing the training,
Oh, yes.
and you are paying for it in some way, and it's not clear to the finance committee for some reason. So let's break out the account lines and let's be done with this. And we can discuss that tomorrow night
Yeah.
as to how to go about doing that, because I think that other purchases line item that you and I
Well,
discussed, it's just
correct.
confusing, period.
Correct.
Yeah, and as long as you have it documented and it satisfies the insurance,
Yeah,
then that's it.
Right.
That works out fine.
Right.
But if in the future something happens and nothing stays the same, we want to be able to not have to scramble, I guess, as far as I'm
and the other issue.
But I appreciate
there-
you guys volunteering your time and effort and doing that. As long as it fits the bill, I'm satisfied.
Is
You
your
know-
documentation available to the public via FOIA request? Anything like that?
Yeah, good. I mean, yeah, we
Yeah.
keep the training records
Okay.
on a monthly basis, and then
They are paper records.
yeah, the
Yeah.
paper.
They're
Yeah.
paper records.
Which-
But I'm sure somebody
which
may wanna
is
know
another-
about-
which is another
Yeah.
electronic record we may do through ESO. So,
Okay.
okay.
Yeah, and that would be, I'm going to speak from the town clerks, because anybody that looks for a records request in your department will come through us, and we'll be contacting you, and it comes back through the town clerks. And if it's easy and accessible, it's works for everybody.
Yeah, right.
If it's paper,
Yeah.
somebody's going to have to pay to go through those pieces of paper, and that has to be passed on to the person.
The other thing that it was brought to light, I have wanted to change this for a long period of time. I just don't know. I don't know if I go through the treasurer and the accountant, or if I go through the select board. Another issue.
Yeah, I know
okay.
personally as an accountant,
Right.
they just come to me, I make the lines, and we're good to go.
Yeah. Another issue is there isn't a line item for apparatus repair or service. It comes out of a vague account. Some of it comes out of fire department other purchases.
I would say the best thing
Right.
is what you need for line items. If you want to be more specific, it sounds like that you make a list of this what you
How
want
I-
to be specific,
how we want
and
it.
it will.
Yeah.
Then we'll work it out, or
Yeah.
it'll be worked
Yeah.
out. That's the easiest thing I can think of as far as doing that.
Yeah,
So.
because the accountant should be able to do it pretty
I
much.
just also want to be very clear.
Yeah.
I'm not looking here that I'm knocking the fire department for volunteering. I'm not asking her to add the expense. The key thing is documentation to protect the town and the fire department from liability.
And it's
It does
there.
not look good when you go, if, say there is an incident, and they say, well, how much do you spend on training? Oh, here's your budget, you don't have a line item at all. That doesn't look good for a
I
fire
know
department.
this is antiquated,
Yeah.
but a lot of you people are new to town, haven't been here a long time. In the 80s, we were sued for a firefighter that got hurt.
Yeah.
He was hurt pretty badly. It was a head injury. And okay, this is before I was around, but I mean, my dad was part of it. My dad and Skip spent
Yeah.
days and days in court. But and again, this is a while ago. But back in the 80s, our records were good enough then, and they haven't changed at all. If anything, they've gotten better. And we showed everything that we needed to show on trainings, on how to wrap hydrants, how to do all that stuff, and the town won.
But remember,
So
40 years.
it is antiquated. I understand,
It's
but
antiquated. I'm here looking, again, I'm not asking for you to, you know what I mean, add expenses to the town or, asking anything more of you. I'm asking here for the protection of the fire department and the town from liability and questions if they have an incident.
Right.
And you say there's no line item for training. What they're going to do, they're going to compare you, if there is a potential civil suit, to EMS and police, because they're going to say, why are you different? Why does EMS have a training budget? Why does police have a training budget? And I'm not
So-
talking about the money. I'm talking about the appearance
well, we
issue.
have all that.
Yeah,
We can show you
again,
file after file after file.
If you could
of
just document
signatures.
any cost, if it's $500 or $1,000, please put
Sounds
a
like
li-
when we realign we're gonna do that.
realign it.
It's gonna happen.
And put a
No
line
problem.
item in.
Yep.
That is all
Yep.
I'm asking
Yep.
for, nothing more than that.
Yeah.
Because that is the smart thing to do today. Again, how we did things 40 years ago.
Oh, I know it's antiquated, but
Yeah.
I'm
Things
saying
have changed.
our records have been good for a long time.
Again,
And when we can produce, and in this instance, we can produce that what our training involves, and it involves a nationally recognized training program, and that we can show that this firefighter attended the training, which covered the actual aspects of what happened to him, that he was fully trained, and he had attended this time, and this time, then that's how the town won the case. From a liability standpoint, it was paper,
Yep.
and it was documentation, but that's.
You know where you want to
from a
have that put in?
liability standpoint.
You want to
that's what
have that
saved the
in our
town.
town report. Something of that nature in our town report that goes out every year, because that gets distributed at the annual town meeting, and nobody then can question, because now it is a document that not only we handle, but it goes to the library, Massachusetts Library, so they have a copy, so they can't dispute anything as far as that you show that you're doing this. So, and it's, talk to Andreas, because she's putting that together. I don't know if it's too late to put it in there, but that might be a great thing to do, because then it gets out not only to us, but, the whole community as far as doing that.
And
So,
when we revamp this, we can definitely put in a training.
yeah, and don't be afraid
line
to,
item.
PR.
Yeah.
Put it in there. I mean,
Yeah.
you guys do a hell of a job as far
Yeah,
as so.
like I said, if there's a cost of a consultant,
Yeah.
if it's $250 or $500, it helps to show that.
Yeah.
If you had a consultant, or any cost of certifications themselves,
Yep.
Right.
any of that. That's the kind of stuff you need to add. So I'm not adding to try to increase your burden on that, or say, what, and I understand you're volunteering, but the thing is, you are part of the town's government. You are.
Yes.
And you have to be smart about things today, about protecting yourselves and the town from any potential liability or questions. That's the point I'm trying to get across.
Morgan?
Yes, Morgan. Hi.
I'm not trying to ignore you.
No, that's okay.
Yeah.
That's why I put my hand up. I
Yeah.
figured
Yeah.
I want
my
you.
turn. Thank y'all for coming tonight and kind of
Yes.
talking through this.
Yes.
To your point earlier, I knew it was my first finance budget season with finance committee. And it sounds like I'm coming at a great time to see like a lot of the changes and sort of reconfiguring
Yeah.
what's happening here. For those of me who aren't familiar with what's kind of tucked into this other purchases line item, the $16,000, because it is a substantive part of your
Yep.
budget
Yep.
After
paying
salaries, it's the biggest one.
It
yeah.
is.
Yeah.
Right.
So what is currently
That-
getting,
That is actually,
into
that
that.
is actually our operating budget for the fire department. That buys replacement parts, it buys, it pays for the service on the vehicles. It also pays for.
Electric bills.
It also pays on, other items that we have to replace, due to attrition. So that's a, I hate to use this term, it's a catch-all that covers several different classifications. And so that line item is basically the operating budget for the fire department for the year.
so, because I'm starting to get to know
Yep.
you all at the same time. I know I've had a chance to talk to Matt about like the EMS budget, and he's got, like, I'm coming into it from that perspective. Like, he's telling me that there's a section that's gonna be like all the Band-Aids and all of the syringes, all of the, so when this gets reconfigured, it
Right.
sounds like this 16,000 is gonna get blown up so that you can have your truck maintenance line, you can have your,
Yes,
I don't know, like your masks and
SCBA or, yeah,
and
or
that kind of
whatever,
personal
yeah.
protection
Yeah,
items.
yes.
Okay.
Yeah.
But that is all what is currently being held in here. Okay.
Yeah, the big items need to be broken out, and the small items, a few of those can be lumped together, I think, but it's gotta have a different explanation or different title for it,
Yeah.
you know,
I think that's
so,
fantastic.
yes.
The
By all means.
largest out of that, Morgan, is by far keeping the trucks. Service on the trucks, anything that breaks throughout the year, and we have to repair,
Yeah.
blow tires, something like that.
Yeah.
That's probably the
Yeah.
biggest amount that comes out of that.
It is.
And what does it look like now for truck repair and maintenance? Like, is that something that you all do?
Doesn't get, no,
Or is that?
we use a
Something
local, we use a local mechanic.
Yeah, most of our, well, we do some in-house repairs, you know, if we have a light bulb that goes out or need a headlight replaced or something very simple, we do that in-house when we do our, what we call it a weekly, weekly cleanup. If you happen to go by the station on a Wednesday night, you'll see a bunch of vehicles there. They're actually doing upkeep on the apparatus as well as all, excuse me, as well as all the fire equipment that we have. Every piece of equipment on a monthly schedule is taken, it is run, it is made sure that it's ready to go, whether it's air packs or ventilation saws or chainsaws. Thank you very much.
He's looking after your health.
Yeah, thank you, Matt. So every piece of equipment is run and checked and tested. Not every piece of equipment is done every week, but we have a schedule where we stagger some stuff. So a lot of repairs, simple repairs, are done by the members that, during that cleanup. Other oil changes, and then any repairs. We've had some repairs done on like the air conditioning on one of the trucks. We've had repairs done on a leaking air system and a battery charger system in the trucks and whatnot. That is all done by either a reputable Raymond's Repair, who was in Bernardston, is now in Winchester. Porter Diesel is another vendor that we use up in Winchester. And we also, our pump work and whatnot is done by Dingy Machine up in Cornish Flats, New Hampshire. So those are the vendors that we do to maintain all the apparatus. When it comes to something more substantial or something more technical, we hire out, so.
Okay.
Yep.
Just for example, our 2003 engine that is up for replacement in a couple of years. 2 or 3 years ago, we were having a pump, putting the pump in gear issue. Had to go up to Dingy. Well, Dingy figured it out. While they had it, unbeknownst to us, they also did a UL testing on it, on the pump. They did a full pump test on it. And they told us that truck was actually in better shape than it was the day it came out of the factory.
Wow.
It performed exactly the same. And people look at that truck and you don't think it's an 03.
Yeah.
So we take very good care of our equipment. We have to.
Well, we
It's our
rely on
highest
it.
asset,
We rely on it.
other than our people.
Yeah.
Now, are you also emergency management, or is that, okay,
That's me.
That's coming up
That's-
next.
That's another head.
yeah,
Still one more question I'd like
go
to.
ahead.
okay, I'm sorry.
At the fall town meeting, there was the town voters approved the establishment of a fire capital stabilization account. I notice in your line, you don't have any request to fund it. There's no funding mechanism for that item that was voted on.
That would be an article separate.
Well, it would be, I think it also has to come as a recommendation from you. What can the town afford to put into it? I think that number comes more from you guys than it does from us, because we don't know the whole
Well,
status and
the thing is,
situation of
we would
everything.
look from the fire department, would look to say, look at, we're replacing in 3 or 4 years an engine. This is our suggestion that we're gonna have to put about this much each year, and you then bring it before us.
Right.
And we say, is this reasonable or not, and recommend it or not. But the other thing too is obviously, so it will not be in, you're not gonna ask for any money in the fiscal year 27 budget at all for that capital stabilization account, correct?
We would probably be asking for an amount. We're in the investigative part right now, where we have actually met with truck manufacturers and fire apparatus people, and we are getting a breakdown. Some manufacturers can't produce a truck for 4 to 5 years.
Yeah.
They're backed up. There's other manufacturers that can do one in about 2 to 3 years. So, what we would do what I expected when we made that capitalization account is that it would be a warrant article specifically to put money aside into that account.
So an article.
Now,
Andrea, are you with us?
Yes, I am.
Okay, when is the cutoff for capital articles, though?
November.
okay.
So you're, it
Capital
does,
requests go out in
yeah.
October.
Okay, so you're gonna be looking at
Budgets go out in November.
next year?
Yeah.
Okay, all right, just because I just didn't want to think that
No.
that we were,
We also
you're
kind of needed to
gonna,
know the number we were going after.
okay.
Yeah, I know that most modern pumpers, if that's what you're replacing, you're looking at 7 figures, $1 million and up.
Yeah.
The other thing I ask you, obviously from a taxpayer perspective, obviously that's a great deal of money and would probably have to be added on in multiple years.
Yeah.
Do you intend to also use any money from the Whitney Fund to help backstop that, to assist taxpayers in the purchase of the truck?
We could utilize some of that as far as that's concerned. We're also trying to hold on to a substantial amount of that to go towards the building.
So you're looking to use that towards the building?
Yes.
which could be possibly several years or a
Okay, all
decade.
right, yeah, we're,
Yeah, so, or maybe at least offer a percentage of that.
Yeah.
I'm not
Yeah.
looking for the entirety,
Oh,
but
no,
a
no, no.
percentage
Right.
to try to offset, to assist
Yeah.
the taxpayers
Yeah.
in the purchase of the truck. 'Cause
I have a question for you.
Yeah.
I have mixed feelings on it. We met with a manufacturer 2 weeks ago, and very, very smart. He was really good. He knew his trucks inside and out. He also stated that one of his jobs, other than selling a fire truck, is to make it affordable for the town. Because every town is in this position that we're in. City, town, it doesn't matter. Everybody's in the same thing. And we were talking, because we were explaining to him about the capitalization and what we wanted to put X amount away, and he goes, have you ever thought about leasing? Now, me personally, on a business end, I don't lease. I never thought it was a smart idea for me personally. You don't build equity, blah, blah. However, he put a pretty inviting thing towards it, saying, basically, they work with, now this company does not lease, they work with 2 other small family-run companies that do the leasing. And he was saying that basically like a 7-year lease, which if we were thinking about doing like a 7-year into the capitalization fund to put money in, basically you could buy a truck at today's price instead of 7 years from now price, which actually would probably save money in the long term, even with the additional, obviously there's a percentage you pay, it's a loan, you have to pay it. I didn't know if that was anything that you guys would ever think about. It's not something that I ever thought about, but it was just brought
Orange,
to
that's
us.
how Orange
We have-
does it.
yeah, we have been looking
What's
at.
that?
Orange does
Orange
it.
does it that way?
Yeah.
Yeah, some of their trucks are.
Because he says
Lease to
it's
purchase.
still your truck, you
Yeah.
still build equity. And the other thing that he said is a lot of companies will offer a pretty extensive discount for paying up front. And if you do that lease process, they're technically getting paid up front.
Yeah.
And then you're dealing with the lease company. So I don't have much of, I'm mixed on it, to be perfectly
It
honest.
has been brought to our
Yeah.
attention as far as leasing.
Gail,
Yeah,
the better consideration,
Generally cheaper than the lease companies is state house notes that can go for up to 10 years. And that's straight from banks they bid the interest rates. That's generally much cheaper than leasing.
Alan bought a truck from Canada.
Yeah. Manufacturers up there.
you
Pay up front because you get the money from the state. The state guarantees the loan to the bank.
Tariffs bring the, yeah,
State guarantees the loan.
To the bank.
I don't think
pay any tariffs because I didn't see anything at it when I paid the bill.
This vendor is actually, he's going to bring more information
Yeah.
to us as far as what the program is, the breakdown of about what the cost would be. So we'll have a better understanding as far as that's concerned.
Well, that's the thing is,
Yeah.
if you do order a fire truck, and
Yeah.
again, do
Yeah.
the manufacturers want some money up front, and
Yes.
or if you wait 3, 4, 5 years, do you pay the current cost of what it is 3 to 5 years down the road?
Right.
And there's also people don't realize there's very few fire truck manufacturers left in the United States.
Yeah.
It's a true statement.
Many of them have
Very
gone out
true.
of business or been bought up.
Yeah.
I think there's only 2 major companies left in the United States that own most of the market.
Yeah.
And the other problem is the delay. You can order one and you're still looking, you could be looking 3, 4, 5 years down the road to delivery.
Yeah.
And the other thing is cost. They're just,
Yeah.
before you could get $500,000, 600,000, now we're over $1 million. We're probably looking at, by that time, about 1.3, 1.4 million to purchase a brand new engine. And so that's my thing is just that's why I was asking if you're interested in a couple of years of buying, are you going to ask for money because I was surprised. I thought maybe you would probably ask for a capital stabilization request. You know what I mean? To put money into the account. That's why I'm asking.
I guess I more or less, didn't understand the timing on it. For me personally, I was really thinking that it was gonna be more of a year. I don't know how you guys work, I don't really know how you do your job, but that, you know what, we have this amount of money left this year, we could put it into that because it's not gonna be a burden on the town at all, and we can put it aside, so however we need to do it.
Yeah, kind of in a fund like that, we kind of look at, free cash, which is left over from people's budgets, and we use that to offset some of the costs so that the tax rate doesn't go up. So we do use that every single year. And we're looking at all avenues, because equipment, not only for you, but for other departments, are getting astronomical. So we've got to come up with a way that is easier to afford.
Right.
And because if we can afford it, that passes on to the taxpayer of the town of Northfield too.
Morgan?
Just more.
Hi.
Hi.
I have a slightly different line
Yep.
direction. I know that the junior firefighters are fairly active in town in events that happen throughout the year. How does that appear in your budget? Or what does that look like?
It's not part of the town.
It's not.
It's part of our association.
Okay.
Our association is which has just gone through a change because our association has been
officially
revamped.
a
And we're
501c3.
now a 501c3 organization.
Okay, yeah.
The juniors raise some of their own funds through a car wash
tax
and
exempt.
whatnot.
Okay.
They also, but anything other than that, any expenses other than that, our association kicks in and helps them out. So it doesn't.
Dan, you
so
mentioned
it-
the PR.
So it doesn't.
PR all comes out of that too.
Yeah, it does. Yes.
doesn't
And
come
you
out.
guys, again,
Everything we do comes out
I
of
think
our
every
association.
department is doing a great job in this town.
Yeah.
Sometimes with constraints.
Just an agenda check.
Yeah,
We actually have to go to Bernardston.
okay.
Oh, okay.
I'm wondering if we go to Bernardston now, can you guys, because I know you still have to do EMP and kind of finish up with fire, can you move on to like the PBRS thing so that we have a chance to finish up with them and come back?
How long do you think you'll be over there, Matt?
Well, he was supposed to start his presentation with you at 6:30.
30, yeah.
We based it on that, so I'm like, at the rate you guys are going, we should go to Bernardston and
I'm on
get it
their
done.
agenda for 7:30.
I think we'll be all set. We're pretty much almost done with these guys.
I think we're all set with the phone.
Yeah,
We can
yeah.
move on. if you-
Oh, we just need the emergency management.
Yeah.
And that was an
And
extra,
that's
what,
not, that, yeah.
500 or something, or 1,500?
Yeah.
That was other purchases?
That is civil defense purchases. That is basically for the code red reverse
Okay.
911 system.
Okay.
They
And
went.
that's
they-
gone up in price?
Huh? Yeah,
That's
that has
gone-
gone,
okay.
that went up in price last year, which they never let us know. And it looks like it's going to be going up just a little bit more. The code red system, is but basically what that line item is. And there again, there isn't any reason why this couldn't be reverse 911 code red instead of civil defense purchases. Okay? Cause that's basically what that one line item is for. They went through a process and they actually got hacked. So they've gone through and revamped the system. And we have the ability to do messaging to all of the community for those people that have signed up for it. And it's a two-tier thing. You can get general messages like snow days and we put one through one of the last storms where the town hall was closed and the dump was gonna be closed and that type of thing. And we also have emergency ones that go out. Some people have opted not to get the general messages, but get the emergency ones. And the last time I sent one out, which is not that long ago, it was actually a pre-recorded, it wasn't a pre-recorded. The message
AI.
was from me, but it was announced by a electronic
Yeah. Yeah.
voice. And I had several people come to me and said, I like to hear your voice. It gives me comfort.
I was disappointed.
So,
And they were disappointed. So
So-
I went back to Code Red and in their revamp, we now have the capability to
Okay.
record personally the message. So it would go out.
okay, so people can sign up for that where?
At the
On our
web-
new website?
Website.
On our new
Have them
website?
yeah, but I'm gonna do an announcement because
Okay.
this new revamp gives them several other options.
Okay.
So I'm gonna do a public announcement, everybody to update their 911 preferences.
Once you get that, let Sandra know and she'll get it out there.
yeah.
The town clerk will get it out there too.
Yeah, yeah.
Perfect.
So that's the only increase in the emergency management budget.
Gentlemen, thank you.
Thank you.
By
Thank
all
you
means,
for taking
thank you.
time out for us.
Thank you, folks.
Yeah.
Anytime you have any questions, don't be afraid to.
I have your number,
We're not
Barbara.
hard to find.
Welcome to finance.
I know this takes time. Is it expected that your budget reconfiguration is something that will be finished this fiscal year, or is it
Yes.
something that will?
Yeah, yes.
Okay.
Yes, it will be.
I'll be
Yeah.
That
It
would
won't-
be great if we can get together again just to see like what it looks like post.
Yeah, won't change the bottom line, all it is give a different line.
Yeah,
Right,
yeah,
because we
yeah.
both bottom line at.
Just
at
to walk
the,
us through it again.
Town
So
meeting
that's the
anyways.
consultant report, the recommendations.
Thank you.
just have
You're
to
welcome.
implement
Thank you.
it into the field system.
Yep.
Yes.
Yeah.
All right, you
Welcome, Matt.
got 3 minutes.
I
Sorry.
don't mean to butcher your name. Wokenbright?
Wokenbright, sure.
Okay. Welcome.
Thank you. Sorry for being on a bit of a hectic
Oh, yeah,
schedule
no.
with all the
No,
rescheduling.
We've been trying to get, I mean, with this, all these
We'll get through what we can
snowstorms.
get through tonight, and I'll come back and see y'all again. And so thank you, Matt Wokenbright, EMS chief. I think I know everybody here. In the interest of time, you have a budget sheet, a series of line items. I sent you a very extensive document a couple weeks ago.
Yeah.
And have now provided you 4 very simplistic charts tonight to take 40 pages into 4 final concepts that I'm presenting. So I would ask for your questions first, and then I'll fill in the blanks rather than going line by line, if you're all right with that.
Yeah. I noticed you mentioned, I know Medicaid, there's nobody
Yes.
else to bill, but Medicare, I always thought there's a secondary insurance that you can bill.
Some people carry a secondary Medicare
Okay.
coverage.
Right.
But we still can't go outside of that
Right,
insurance
right, but
billing
you-
to bill the patient.
Right, right, but you
Correct.
can bill the
Correct.
secondary.
Some people have a supplemental.
Right.
Even
Okay.
some
I
like
just
town
wanna-
employees take part in
Okay.
the supplemental insurance.
Okay, just
Yep.
want to make sure that was out there
That's a
clear. Yeah.
perfect question.
Well, the other thing, question, I think for the public's knowledge, you should advise them of what the reimbursement rate is for the Medicare, Medicaid. And I saw from your figures that a majority of your runs are Medicare in Northfield at least. And that, so I think you should, tell the people what your actual average run cost is versus what you're being compensated for.
Yeah, I'd be happy to touch on that. Absolutely. Are there any other kind of big things or questions? And I'll tie them all into one long.
I think people would, again, since we're on air.
Yep.
How many call-outs you had during
Sure.
the year? That would be,
Yeah.
Okay, so I'll
can
give
equate
you a
to
little
that.
synopsis then, if that's what
Okay.
you're looking
Perfect.
for. Thank you for that. I appreciate it. And thank you for reviewing things, obviously, ahead of time. So in this past year, we've done, last calendar year, we did just under 1,100 responses or requests for service. 1090 was our final number. And when I say a response for service, that means somebody has contacted 911 and we have sent at least one ambulance or crew to the scene. Not all of those requests result in a transport. And so when we're kind of talking through this billing and revenue generation, the only time we generate a bill or a potential for revenue is when we transport someone to the hospital. So as we look at sort of the numbers and everything else, when I look at the total budget and come back to the cost per call, we end up actually at over $1,000 per request for service. That it costs us when we look at our total budget versus the number of times we go out the door. When we think about how much we bill versus how much we bring back, well, we may bill $2,000 to $3,000 for an ambulance transport. As the Northfield bill, insurers have set rates, and those set rates are dollars on the hundreds of dollars. In other words, we get reimbursed $300 to $400 for some of these calls that may be billed out at a couple $1,000s per request for service. So we're seeing on average about 30 to 40% back on our total billables. In the documents I sent you all, and I'm actually trying to pull the page up here as I'm talking, we had billed out in 1 month over $1 million worth of services that had been rendered, and our reimbursements on that was about $360,000. Just to kind of show a mean average, if that's what you're referring to. So, okay. As we look at EMS, it's the insurance policy, and there's a fixed cost to the services we provide. To be available 24 hours a day, 7 days a week, we have to pay for the vehicles, for the people, for the training, for the insurance, for all of the supplies, much of which have expiration dates. And so those costs, whether we actually move somebody to the hospital or not, don't go away. And that is about 70% of our total budget when you look at it, are just costs that are going to be there one way or the other just because we exist. So as we look at our budget this year, I think I'd like to just kind of touch on a couple of things. One, our overall budget didn't go up that much. There were some key drivers that really are pushing our bottom line this year. Health insurance, as we know, had a massive increase to the tune just for EMS of about $55,000 for our employees. We also had expected to be in a new building last year with equal operating costs, which didn't come to fruition. So we're now in a temporary trailer with extra utilities and an increased operating cost of about $14,000 for this year. Our EMS insurance has gone up some, not by any fault or anything else, just because all insurance have gone up. And because of some of these major drivers that have happened, what we've seen is this increase in our cost that feels very exponential before I even give the numbers out to the public who are all waiting with bated breath and you all are looking at on your sheets. Also, last year's budget, and when we figured out our operating budget, our capital, and then the assessments to the town to help support EMS, we had two significant funding streams that kind of met between budget and town. One of them was a grant that we had about $88,000 left in, which was the implementation grant for EMS, which was applied. And then we also used $165,000 of EMS's retained earnings to offset the cost of EMS. So we had some savings and we had a grant. Those are not necessarily available this year. The grant certainly isn't, and retained earnings I'll touch on in a minute. But when we take the major drivers, the grant offset, and the use of retained earnings out of this increase in budget cost overall, we really are only seeing about a 27% increase in our budget. Absent those figures, before we put in the health insurance and the building costs and the operating costs that we couldn't avoid or predict. So while we're starting to see what I'm calling a normalization of the cost to operate EMS, we've still got a couple of years to go. And that's not by any fault, it's just because we have to settle out into a pattern. The other thing that I just need to kind of point out or highlight is that our reimbursement and our revenue stream is not consistent. I can't tell you that if we do 10 calls this week, next week I see payment for 10 calls. It takes time for us to work claims, sometimes up to a year to even decide whether we're going to get paid for them or not before we write them off our books. And then also month to month to month, we're getting chunks of money, but it's not like a net 30 invoice that a business might send out. So when we see these drivers or these amounts of money, and I think I had a graph in your paperwork that kind of showed in January we might get a very large sum, February might be small, March up, June down, so up and down. And to try and project what our revenue will be based on our payer mix or the insured, based on the timing for it, is a really difficult thing. And I don't have great data. I came to you last year with 3 months on the job and said, I'm taking a lot of guesses. I've now got a year and 3 months on the job or so right now. And I'm still saying we're coming up with patterns and trends, but we don't have a lot of it. So as I look at our budget request for this year and what we're trying to do, the operating budget that I've presented to you, it's at $1.27 million, $1,270,196. The line items are broken out in there. I can go in deeper to each line item if you're curious. There are some increases, which I've referenced on the right side of the page as well, about how much year over year we've gone up. There is no capital included in this year, and I'll come back to that in a second. But what I have done for the budget is tried to consolidate and streamline the most efficient and fiscally responsible budget that I can, that provides us with a reasonable expectation that we can afford to run EMS for the year, because I would hate to have to come back to you mid-year or late year. And something that is now supporting 6 full-time EMS providers who we have hired successfully this year and are doing great on top of myself, plus our per diem staff, plus their training time, plus all of their benefits. And I have about a year's worth of data on how much it costs to operate things, fuel, equipment, medications, and started to get a handle on some of the capital replacement equipment that we had looked at last year. And I said, we've got to accelerate the schedule. We actually did a pretty good job this year with an aggressive maintenance budget and aggressive preventative maintenance program on our equipment, to be able to sort of move some of these costs forward and increase the longevity of our equipment. So the budget that's here is what we're looking at for operating expenses for the year. The pause would be questions on the budget, I guess, before I go further on that.
I've got a couple of questions here. Obviously, you mentioned the issue of debt and writing them off. It'd be appreciated if you have a line item for debts that are outstanding and that you're going to write off. I'd like to see that in the budget to see how much we're actually basically losing money.
Yes.
I'd like to see that. The other thing that I know you in the past you provided the information on doing runs to other communities that are not members of
Yes.
our district.
Yes.
I think that we need to institute, if there is a certain level of runs,
Yep.
then we should be, like some other communities are doing, they should be charged for those runs. The community should be charged for that.
Perfect.
We should not be, forgive me, subsidizing, especially if they're making more and more of a demand on our services and are not
Yep.
paying an assessment fee.
Yep.
Then we should have an institute a fee for that service. Those are my only 2 questions.
Perfect. If I can address both of them, and thank you for those. The write-off amount I will have for you. I will not likely have it right now.
No.
Or I don't
No.
have
No, but
it
in
because
the
of
future.
delayed.
Yeah.
And because I've changed the way we're documenting and recording everything,
Yeah.
I'm trying to come up with it, but I will absolutely be providing that to you, as well as working with the advisory committee comprised of all 4 towns. That's a conversation we're having to look at the process for forgiveness,
Yeah.
write-off, and for assessing sort of what it would be considered non-collectible debt.
Yeah.
Things we can't do, because quite frankly, it's a deep, multifaceted process. It looks at income, it looks at status of the person, estates for people who are now deceased, whether there is an estate or not, collections companies, contact for them. So we are actually working on a process, a policy, if you will, so that we have a consistent way to look at each interaction with our community members and those outside and deal with those. So not only can we give you a number for write-off, but we can give you here's how we looked at it, or how I looked at it.
I think that's
dealt
important
with
for
it.
transparency for the public, that
I
they're
agree.
aware that, yes, not everyone, unfortunately, not every run is paid for.
Yep.
Some of them we have to, forgive me,
Medicaid, yeah, Medicaid.
we
you
may have to eat.
Yep.
And I mean, you may get some reimbursement from Medicare and Medicaid, but then there are some that they're just a total loss.
And I mean, the biggest one I will just put out to you, not just the capitated billing like Medicare and Medicaid, but someone with private insurance who can get a bill for their deductible or the balance of it because of the
Yeah.
way the billing process works and their insurance, co-insurance type stuff. Some people can't afford the $500 or $1,000 or $2,000 that might be left
Yeah.
that their
Yeah.
insurance isn't paying for because they're underinsured or they have different type of coverage. Those are the ones that I really worry about because I never want EMS to be a burden on someone. So I'm
No, I'm
working on
concerned
that.
especially with the federal government cutting
Medicaid,
insurance
yeah.
to
Yep.
their, the subsidies,
Yep.
the CARES Act or
Yep.
Obamacare, whatever you may call it. I think it's just important that we show that we do have people who cannot
Yep.
pay for the insurance. This is what it costs.
Yep.
It's not through any, I mean, we're not all here to blame them or
Mm-hmm.
chastise them, but there are costs to the community that we are not recoverable, and I think it's important we show, so we have an idea of what we're actually,
I agree.
what the losses
And
are.
I
on
am
the budget.
working on that for you, and I will have it.
Yeah.
Possibly mid-cycle, even before we hit next budget season. That is one of my things. If I can just address your second point, give me 1 second. So I continue to monitor the number of calls done within each community, month by month by month, and every advisory committee I provide a report to them for it. I still maintain that as long as 20% or less, so 1/5, we're 4 towns, 1/5 of our total volume still provides us about 1/5 of our revenue. I know it's not perfect math since there's always fixed costs for us. We're doing okay, and that's when I would start to flash the light. We're not at a 20% or over 20% utilization outside of our 4 towns yet. But it is on the advisory committee's list of things to begin talking about so that we can get the 4 communities to start talking about how do we engage under the intermunicipal agreement with other towns and how they are not, as you said, taking advantage of the service. We want everybody to be playing a role here and have a part of it. So I am monitoring it. I do not believe that we are funding any other community unjustly. We are a strong partner in the region. We are a growing partner in the region, and there are a lot of changes to how EMS is being provided in the region. And so I would suggest that probably over the next 6 to 9 months, the advisory committee and the other agencies will be discussing some of those things, and we may start seeing some of those potential apron charges or other agreements with communities for service to help fund or offset costs. Thank you for that.
I have questions about 2 line items
Yeah.
that really end up as net zero, but I'm just a little curious to know what's going on behind the numbers. The building lease and EMS other charges. The building lease adds 14,000, but the EMS other charges takes away 14,000. So, as I said, net zero.
It's kind of a unique game. Go ahead.
It's fun.
Yeah.
So the question behind the building lease is really more of a, does this take into account the anticipated need for the temporary building? Like what is this looking like? For the
Right.
next
So
year?
what the building lease line item is prior to whatever day we closed on the Sandry property and the donation property that were accepted at the last town meeting. We were paying, what was the date? January 23rd, thank you. We were paying a month-to-month lease to the property owners for the site for 41 Main Street. In July of last year, because we needed to have living facilities and everything else, we had to add the trailer, which added a cost.
Yeah.
So the building lease cost, we are no longer paying rent for the property because the town now owns it after the purchase. But we still have to pay for that trailer and the increased operating costs of it. So what I've done this year is taken as temporary fees and added them in as building lease until such time as our permanent home can be built. When it would revert back to the town owning the building, operating costs would remain, but there would not be a lease charge for the building.
Is that a month by month thing?
It is a month by month. The building committee, emergency services building committee, had voted to pay for and fund our temporary structure through the end of the fiscal year out of the funds in that account. So that's how it's being paid. So as of July 1 in this budget, I'm asking that it comes and be shared by the 4 towns rather than just borne by Northfield.
Now, would you, it's month by month, would you consider maybe going a little bit longer term and maybe getting a little bit better deal?
It is a set fee indefinitely, basically, is the way the lease agreement is written on the trailer. So basically, we can keep it, we can tell them, next month we're gonna be all set with it, and I don't remember the specifics of the agreement, but basically, when we're
Like a
done with
30-day
it,
notice.
they take it back. Yeah. But I anticipate we're gonna need it for a little while. So that's why I brought that into our budget this year as something that could be divided up amongst the 4 towns. The second question you asked was the,
EMS other
EMS.
charges.
Correct.
I hear you saying that you are coming in and it's sort of reconfiguring as
Yep.
makes sense best for you. So perhaps this is a moot question.
nope.
It was 25,000, then 26,000, and now we're
Yep.
dropping down to 12,000.
Yep.
What was housed in there that is no longer housed in there?
Great question. So, what I've really done is started to try and figure out what falls into each one of these buckets. And as you can see, some of our lines even have 0 amounts on them this year because we're no longer going to be using, but I didn't want to delete the account this year without having this clarity and transparency. So under the EMS other charges, one of the fees that was under it was all of the indirect costs that were paid to the town, which was a substantial amount of money. The other thing that was in there that is now in its own line item is some of the insurance costs that are there. And then it was kind of a catch-all. So I've gone and tried to actually break down into some of the other things like the maintenance supply items that went up a little bit, the fuel line item that went up some, building maintenance went up a bit, because those are real costs that I can actually see from the last year of my tenure in operation and put more realistic figures at them rather than just having that one big other charges category. Now inside of the other charges, we have our equipment preventative maintenance, our biomedical certifications for them, management of some of our supplies that aren't capital items but have to be replaced, mattresses for the stretchers, straps for the stair chairs, buckles, things like that that are durable items that will likely fail and have to be replaced but aren't medical supplies that I can use on an individual patient. They're reusable items that have a lifespan of a year, maybe 2, and we needed to have a place to pay for it but not overwhelm it. So does that answer your question a little bit?
Yes, just to clarify that I heard correctly, the funds that have remained, that $12,000, are those more durable items that just need to be replaced on sort of an ad hoc basis?
Correct.
Gotcha.
Yeah.
Okay, thank you.
So that's paying for those and some of, like I said, the fees. I didn't go as deep as to create a specific line item for my biomedical, and we pay a fee to the vendor to come and certify our equipment and manage it. It's a warranty kind of a thing, so we don't pay out each time a stretcher gets serviced. They just come in and do it as needed.
Thank you.
The question here is the retained earnings use models. You've given us
Yes.
5 options. Obviously, you would probably prefer the option number 1 probably because you wouldn't use any retained earnings. But giving 5 options here, what happens if the member communities disagree on the retained earnings? Because you may say, Northfield may say, yeah, but we're fine with that. We'll pay the, 218, 2,272, but you may have Gill, Bernardston may say, no, we don't care for that model. We want to use. How do you reconcile if there's a disagreement amongst the communities, which retained earnings model you're going to use?
So I'm glad you asked, and that was kind of the summary of all of this for me, right?
Yeah.
Why we're here tonight. So with the advisory board, again, that is made up of representatives from all 4 towns. We've been meeting bi-weekly, monthly, quarterly, as needed as we go through all of this, and had a lot of discussion. which is how the intermunicipal agreement was framed, was to get input from everybody in all 4 towns. And what they've come back to on your retained earnings use model is the one that's the largest, is the recommendation that we use $90,000 worth of the retained earnings this year. Now, mind you, there's, I believe, 294,000 and changed in our certified funds. So their recommendation is to use 90,000 of it this year, and that's based on a very conservative revenue estimate. Again, last year we had estimated we would have an over $800,000 revenue to apply towards our budget. We're going to be close to that. We're going to be okay budget-wise. I don't think we're going to have a deficit when we all said and done, but looking at our collectibles having better ability to track things and some of the stuff you had already brought up about write-offs, I've actually suggested that we bring our revenue estimate for FY27 back to $760,000. I would rather under-promise in revenue and over-deliver and end up with something going back into retained earnings next year. So after a couple of meetings and discussions, the suggestion from the advisory committee is that we actually take a risk. We use a portion of the retained earnings and a not so unsubstantial portion of the retained earnings to help to offset the cost of the assessments to the towns this year. The other thing that we're not doing this year is a capital assessment. I do have a capital item. I'll talk to you about that in a second, but we were very aggressive with maintenance in my first year. The town of Northfield approved the reserve fund transfer to help us with some substantial maintenance to our vehicles. We have a new ambulance that should be in build here very soon that was already approved last year. I am optimistic, while we will keep a little bit larger fleet, and I'm not going to get rid of one of our trucks this year, that by being able to continue to rotate through them and continue with our maintenance program that we have, we can actually defer another year before we have to look at even thinking about ordering another ambulance, which will be 2 or 3 years out at that point. So I think we've done a very good job this year. I'm a little more optimistic about our capital replacement. The advisory committee is in agreement with looking at all of that and talking through it. And so I think we can safely use that $90,000 was kind of they felt like it was a good number to help offset things this year. It may not work every year. The use of retained earnings is not a great business model to help pay for things. No. But while, again, we're trying to figure out what our normal is going to be, I think it helps the taxpayers, it helps the town. We know we have the money there. We don't have another immediate need right now for it. I think we're in a good place, and I think that is a responsible use. While it's a large portion of retained earnings, I don't think it's an overuse of them. Also, I'll just kind of point out, and I think I had it in your homework, but other similar regional services are paying over $1 million collectively in assessments to fund similar regional type EMS systems. We're sitting at the $600,000 mark right now. I do realistically expect that as we start to normalize this, we may see another year or two of adjustment in this before we figure out where we're really going to be and what the cost of business for us to run this service overall is going to be. But again, it goes back to the 4 towns. We're providing the service to the community, and I think we're being pretty responsible with the money on it.
I can just add,
Please.
since I sit on that board, it's pretty much a consensus driven. So there's quite a bit of discussion for like 2 or 3 hours, and that we arrived at supporting what Matt was doing. We agree with conservative revenue, right? And then we're also looking at these numbers as over a 3 to 5 year process. So similar to sewer, because I'm on that as well. And sewer's in the 3rd year of having consistent data and budgets. EMS is in their 1st year basically with a new system. So we assume this is gonna feel more comfortable not necessarily the dollars, but the process will feel more
Yeah.
comfortable, and the year-over-year comparison of dollars will be more comfortable in another couple of years. The other reason why we opted for putting more of the retained earnings than I think normally this year is because, if you recall, we had a grant that helped with this whole transition process, and that ended last year. So we're also looking at how would that help this year, because we didn't want to see huge assessment increases for the individual towns. We wanted to ameliorate that somewhat. So that's some of the discussion to support what Matt's saying, and also just to give you the perspective on how the group arrived at this.
I'll also just quickly kind of put out, because I know you had brought it up with the fire department, separate budget, separate thing, not comparing by any means, but we would, as the advisory committee has discussed, actually requesting, whether it be at this town meeting or a future one, the development of the capital stabilization plan once we're able to truly lay out a better vetted capital improvement plan. And so whether we create it in this town meeting or the subsequent town meeting and then fund it with the FY '28 budget would be the plan to start saving for the future, for future capital plans, because we don't have that right now. We had talked about it last year. We did a very large payment towards capital last year. And so that's kind of where that's headed.
All right, you have to be out of here by what? You have to be.
I would just point out, because the note taker is not going to be able to see who's speaking,
That it was B. Jacques who was speaking, because she's neither on camera nor identified, just because I know that when she goes to take the minutes, she won't know. Sorry, didn't mean to interrupt.
Lead you with here. So when he goes to town meeting and the person gets up and says, how come our assessment went up $81,000? You're gonna have to be able to justify
Yep.
that. That's all. And
And I think-
I understand.
Yeah.
I would
Yeah, but you get
ask
to make
that
it-
when we get to the info sessions,
Yep.
which I'm hoping we do again.
Yes.
We will.
We can put all this material out with the advisory committee. They're still working on some of these graphics. That's why I've been putting them out to all of you and to the select board and to the advisory committee to be able to look at this stuff. Let's come up with the best graphics that we can, the best pieces of information, and I would welcome your feedback for, just like you said, what will help people understand the best where those major drivers really shifted this assessment, because it is substantial. There's an increase this year that we couldn't do anything about, and then there's a piece this year that is just a factor of inflation, that 20-something% that's in there.
Yep. Just keep it in
Yep.
mind, because that's what's gonna have to justify. So
The other thing, one last thing, is not so much of the budget issue. I see you have the warrant article request. I do ask that, because most times when we purchase equipment like this, we want quotes.
Yes.
And I'd like to have a detailed inventory of what you're actually purchasing
Yep.
and the price of it. Now, I know you have two choices. You either go GBC, Greater Boston Council, or the Plymouth County to purchase what you're looking for is basically a Ford Explorer type vehicle, correct?
So we're looking at a Tahoe platform right
Looking at
now.
a Tahoe, okay.
And it's an HGAC contract that 2 or 3 people have provided quotes, which I'm happy to provide to you.
Perfect.
Before we really get too much discussion
will.
on it, if you could, that
Yeah.
way, before we waste our time talking about it, I think it's good to have the quotes so
Yeah.
we can look through it, look
Yep.
what you
We'll
want.
probably ask you back.
I'm
at
happy
that
to,
point,
because
yeah.
that number's been adjusted, so if we could get on
Okay.
a future meeting to discuss that,
Yeah.
I would really
That would
welcome
be,
the
that'd be helpful
opportunity.
for us.
we will do that.
Yep.
I'd appreciate
Yeah.
it. And if you have other questions, please let me know so that I can prepare and I'll follow you up on it.
Okay.
All right?
Well, we'll take it back to the MS. because we have
Thank you, sir.
coming up,
Appreciate
so we're
that.
taking
Yep.
feedback from the FinCom back into the EMS advisory.
Yep.
Yeah.
Anything else from me tonight?
Thank-
Thank
No,
you.
thank
Sorry
you.
to
Thank you.
rush
Good luck.
through
Thank
it.
you for
Good luck in
taking your
Bernardston.
time
Let me know
out.
when we can meet again.
Yeah, hopefully it won't be a snow-covered one.
All right.
Thanks.
Thank
Take care of
you.
yourself.
Okay. Minutes from,
Can I just ask one question?
Could I, before you get into the PVRS budget or anything, could I ask you to move my update up, because I have something else coming up at 7:45?
Okay, do you
Um,
want us to wait till the minutes too?
Yeah, no, you can do the
No, we
minutes.
can do hers.
Want to give you a heads up.
And, because I just have a couple things, it'll be brief.
Administrator update after the minutes?
Or do it now?
That'd be great, thank you. Okay. Is there a motion?
I, Bernie Parada, make a motion to accept the Finance Committee meetings from Monday, February 2nd, 2026, as written.
Seconded, Robin.
Oh,
Niedermeyer.
God, I wrote down 25 on the agenda.
I think
Oh,
we
they're
could-
both 2026.
Yeah,
Here we go,
Okay.
there.
those are corrected.
Okay,
As corrected.
okay. Is there a second?
Seconded, Robin.
Okay, any discussion, corrections, edits? Okay, I, Gail Weiss, vote to accept the
Dan Campbell,
minutes as
yes.
written.
Bernie Parada, yes.
Morgan O'Brien, yes.
Lindsay McCarthy, yes?
Robin Vandermeer, yes.
And we have minutes from 2-2. Minutes from 2-9, there was a comment. Who was with Bob at, well, we probably should put the motion out there to accept the minutes from February 9th.
Yeah, we can, is there an issue with the?
Yeah, I guess they didn't know
that
who was
the
with
chair-
Bob.
That
Yeah.
was the chair of the,
Okay,
health
did-
board, correct?
What was his name? I guess, was it Wendy? They didn't know who it was, so it wasn't,
You mean the chair of the Board of Health, David?
Yes, he was present with Bob.
yeah.
David Balk. B-A-L-K, is the chair of the Board of Health, yes.
He was there with Bob, right?
Yeah.
Okay.
Correct.
Okay, because there was, I guess they didn't quite clarify who they were, so.
Do you
we
want to
just-
have that corrected, or do you want to just make a note of that? Because we
Can we have that corrected?
yeah, you can have it corrected by the scribe.
Okay, and
If you want to
then,
do that, or we can note that it has to be, the name has to be added.
Okay.
Some way, shape, or form.
so what, we should make a motion to accept and then edit with David Balk?
I would say we don't accept it until it's been changed.
So, yeah, I wouldn't accept it until it's corrected.
Okay, so I'll send a note, was it to the board clerk, let her know it's David Balk, and then she can resend the minutes and we'll vote it next time around,
That's,
okay?
Okay.
Okay, and I think that was the only name she was missing.
Yeah, I think that
Yeah,
was.
I
that
think
was
that's
pretty
what I
much it.
saw on the 2-9 minutes.
Yeah.
Okay, so, Andrea, you want to go with your update?
Sure. I know that you had a view town budget first, but I'll wrap my comment into that. I did send you the updated budget workbook. I sent another one this morning after the changes from the fire department came yesterday. I just wanted to point out that I did add a separate page under the item, the warrant item articles with just my notes and comments and recommendations. And again, as I said in the email, just take them as you will. Obviously, you can play with all the numbers and, you know, you guys will obviously make a decision on what you're going to recommend forward, but happy to talk about any of my reasoning, maybe at the next meeting when I'm actually physically present. Just a quick couple of things. One is, I just got notified today that we are going to get some funding from the direct local technical assistance. This is from the FERCog. And so they're going to help us with doing an update on our Complete Streets program, which is great because we use those funds to apply for projects, including things like Highland Sidewalks, which was very popular. So I'm really pleased that the FERCog staff is going to be helping us with that. And it also looks like they're going to continue to support the downtown district position, which is doing some economic development work, if you weren't aware of that. And so some culvert assessment inventories for the town. So those will be really, really helpful to the town for the technical assistance money that the state gives to the Regional Council of Governments. So hot off the press, the select board didn't even know that yet. I just got it a couple hours ago. Then the other thing is the sewer payroll change in staffing. So I sent a little note to you. Karen, I said to Karen, you don't have to come to the meeting tonight, Karen. You're decreasing your budget and rates, so I'm sure everyone will be happy. But basically, she just wanted me to give you a quick update. She's very sorry about the fact that it's a late change, and she apologized profusely, but she had some major discussions with the chief and some of the other staff, and they've decided to, because they have not been able to fill the full-time assistant operator, chief operator hours, they've decided to take one of the part-timers is going to up their hours a fair bit. Another one is going to instead of working every other week or so, work every week for 5 or 6 hours. And this is going to allow them to eliminate that position, but keep in the same number of hours. There'll still be some additional hours that either one will pick up periodically as needed on those weeks. And so it brings the budget down a little bit in terms of staff cost, but where it really saves money is in the cost of the health insurance and some of the other costs associated with a full-time versus part-time employees. So they are supposed to staff the plant with so many man hours, and that's what they still have in the budget. They're just breaking it out. They're still going to look possibly to get someone else to pick up a number of these hours part-time, because apparently there are other operators who are more interested in part-time hours, who work other full-time jobs. And they're thinking they may actually end up with more staffing by doing it this way. But the direct result is that it will take the budget down because they will be dropping some of the costs associated with full-time employee. And so they feel like this could be a win-win, actually getting better staffing and more people, and being able to reduce some of the costs associated with running the department directly on the rate. So I don't know if anybody has any questions on that.
Did they mention potential of being cited by the Mass DEP? What
Well,
are the
Said there's
real risks there?
Right, right. And I think she's just kind of covering her tracks there. I think DEP is concerned about the number of man hours, people actually in the plant for the amount of hours the plant is open, which is 24/7, but they want a certain staffing level. So they're doing it this way, but they don't know that DEP is going to say you have to have a full-timer versus accepting these part-time positions. So she kind of threw that in there as a, hey, we don't know if DEP is going to say, no, we want you to have a full-timer in the budget. And if that's the case, they'll have to go back to doing that. I don't think there's going to be anything punitive. I think if DEP sees that they're actually finally getting more staff, I think that's helpful. I think it takes some of the pressure off the full-time operator and some of the part-time operators by actually increasing the amount of other assistants, if they can, especially if they think they can get another part-timer or two to take some of those hours. So I really don't think that's going to happen. I think Karen was just pointing out that DEP could come back and say, we'd rather you have a full-time position. And what they're saying is, we can't fill it.
Right. Yeah.
So I think that was more that what the comment was about.
Okay.
It could come back.
They would all be certified, all these part-time people?
Would be
Oh,
certified.
yes.
Okay.
What they're
Finding is that there are either retired or
Yeah.
people who have full-time jobs who would take another shift a week. They're all certified.
Yeah.
Or you could even start with someone who has low certification and they work, under
Right.
supervision until they can get more certification. But if you're going to fill a full-time operator position that's operating independently, you are going only for a certified position. And water and sewer operators are almost impossible to find. They are so in demand. So what they're finding is that part-time might be easier to fill. So that's that's the approach they're going to take. And then the last comment is, you have the new schedule. Obviously, the big change in the schedule was that we had to keep moving the emergency services department, and obviously the chief is not available. Police chief is not available tonight. He already had a planned vacation scheduled, so he is aware and is scheduled to come to your next meeting to go over the police budget.
I also told Council on Aging that they need to do something with their.
Come at 6:30.
Yeah, no, they want to come before you again, so
Oh, yeah.
we told them to come next week too. So
Right.
that will be on the agenda for next.
Right, I contacted Deb Lanu and she said 6:30 was fine.
So I don't know if there's any other questions on the budget sheets I sent you. I'm starting to try to put together a budget so you can actually start, you can manipulate it yourself to see if we raise this or lower this. The effect on the budget summary that you can see on the first page. If whatever you change, you go back to the budget summary and it starts to show you where all the lines fall in and estimated tax rates. Again, I always caution people that estimated tax rate that we see is all based on the estimated revenues and expenditures. We have never ever paid the estimated tax rate or exceeded it. In fact, last year, the estimated tax rate was fairly similar to the one we have now. It might have been 14, I have to go back and look, but it was over $14 and it was certified at 1358. So that isn't to say I can promise anyone what the tax rate will be. All I want to say is that estimated tax rate should be taken as it is, an estimate. And we're generally very conservative with that estimate, which means that inevitably the tax rate is certified lower. And that has mostly to do with the revenue estimates.
Looks like we're using over $400,000.
It's about our excess levy capacity.
Well, it always shows that,
Okay.
but when you recertify it, it
Yeah.
magically comes back because when you get the revenues in, that excess levy capacity shoots back up.
Okay. And
Because
then,
that's
towns-
inevitably what happens is we end up with more revenue than we're estimating, which is the safest, most conservative way to do this. But you just do not ever want to estimate your revenues wrong and end up underfunding your
Right.
budget.
Yeah, I just got an incident in one of my towns where they had like almost $500,000 excess capacity 3 years ago, 116,000. It was like sticker shock because it dropped like 200. Everybody, their bills went up because of that excess capacity went down so much.
So you want to be, I mean, I didn't increase much on the cherry sheet receipt estimate because first of all, we don't have the House one. We have the governor, which is always just take it as you will. And I level funded the local estimated receipts. I'm very conservative with new growth, which is where we have actually seen much of our revenue in the past, but we are very conservative with it because that is something we can't bank on.
No.
We really don't know what'll be certified. The big drop you'll see, which really helped us this year, is we are requesting less in overlay. We had some big cases. We had specifically the First Light case that was in tax title. And so we had put in a rather large amount in overlay in the previous year. So we are reducing that. I mean, I talked to the assessors about this. We work on it and come up with an estimate and a recommendation to only $100,000 on overlay. That goes directly to the tax rate. So obviously you can see by dropping that amount, it brings us down a fair amount of what we're putting on the tax rate. Now, that can vary year to year if we need to raise more overlay. And it would be a great, maybe after, maybe a summer project to have the assessors come in and talk you guys through overlay and what that is and how that works and what all that means, and including a appellate tax board, because I think that might be an interesting an educational thing that you guys would be really interested in understanding what's happening with that, but it can be a large driver on the tax rate and it goes directly to the tax rate. So, and again, you're just, obviously seeing this since the end of last week. So, any questions, you feel free to shoot me at any time. You don't have to wait till the next meeting if you see something. But again, you can always, go to the town meeting article page and play with your own numbers, what should be free cash, what should be raised on taxation, what you want to fund, what you don't want to recommend funding. That's for each and every one of you, but the spreadsheet should be self-automated. If you start changing things on those annual town meeting article page, it already feeds into this to the budget summary, the budget summary page, and you'll see those numbers shift automatically. So.
Andrea, I've got something, if you'd be enough to, we have to address from a prior meeting. The issue of, we had the transfer station budget presented to us. Unfortunately, there were errors in their budget. I'd like to see if you could contact them and have them present a revised and corrected budget to us, because there were some mistakes. And the other issue too is if you could ask them the amount that's in their revolving fund. And the other thing is, they had 3 capital requests, but with no price quotes whatsoever and no specifics. If they're going to have capital requests, would you please, like I said, we think we need more than a guess. We need facts. And the other thing too is that if you could ask them, when was the last time they increased the dump sticker prices and the bag prices? How many years ago? When was it last increased? If you could get that to them so they can hopefully come forward to us again with the answers and a corrected budget.
I'll work with Bob on that.
Super, thank you.
Let me know if you need anything else.
Anytime, just email me back and I will be happy to respond.
Is that it for your update?
That is it for my update. I know you guys want to talk about the budget and the school budget, so I won't spend any more time.
Okay.
Thank you, Andrea.
Thank you.
Thank you.
I'll see you next week.
See you next
Okay.
week.
So the PVRS budget, comments and went up? Yeah,
Well, we got the assessment information, their final version 4. We also got the increase that we're gonna be seeing for the town of Northfield. And the other thing is, we also got the Northfield share, a capital budget of $83,023 for repair or work up there at the high school, middle school. It's a substantial amount of money, and of course, our assessments went up, but our neighboring communities that are part of the district, Bernardston and Leiden, they went up quite substantially. And my concern here is the budget is that this is going to have a major impact on the town's finances, on the tax rate, and we may also see that we should be on the same page as, with the other communities. What are they going to do? If they vote to reject the budget, it only takes two towns,
yeah.
and then they would have to do 1/12 of the
Right.
prior year's fiscal budget. We're going to have to decide, is this increase and this capital acceptable to us as a finance committee, and we're going to have to make a decision if we're going to recommend or not recommend their budget, and the reasons why if we do either. So I think that that's an important discussion. This is the largest department, or
Yeah. Yeah, they're over half the
largest
budget.
part of the budget of the town, and the townspeople are going to look to us to see what our recommendation or advice is on this matter.
Is Jane gonna do like a 3-town?
I don't know. I have
Yeah,
not heard
it'd be-
anything.
It would be good if she did, at least get some feedback.
Yeah, because we'd want to,
Yeah.
kind of support our neighbors a little bit if
Yeah.
don't let them hanging.
Take them into consideration.
We can't wait to the last minute to make
No.
our decision,
Right.
because
So-
we should, coordinate and be fair to the other communities. I mean, that they know, what they're gonna, hopefully they'll be upfront with us, telling what their plan or what their recommendation or not recommendation is gonna be. So, not to say that this will make our decision.
Right.
It's gonna be just part
Part of it,
our
yeah.
decision making of what we're going to do.
Yeah.
I think that I can understand their budget going up on insurance costs.
Yeah.
All of our departments are being significantly hit by that.
Yeah.
But the other costs involved, like I said, this is a pretty substantial increase in their budget.
What
And,
was it? Wasn't there like a $10,000 increase for somebody's, like the IT people or
Yep.
something?
Yep,
Yeah.
So,
and she got one last year too,
Yeah.
so. That was asked at that last meeting and Patricia gave the expected answer that it's just bringing up to market rate.
Yeah.
I'd love to see what those figures are though. I mean, people say that.
Yeah. Is there a
Show
what?
me a
The
chart.
problem is, when it comes to town meeting, you can't go to the line items.
Yeah.
No, I know.
You have to accept it
Yeah.
or deny it
No,
as
I'm
far
just
as
talking
that.
about that
Right.
particular
Yeah.
Yeah.
situation.
Yeah.
When asked about it, she just said that's market, but
I
I'd
mean,
love to
do the
know
3
what that
towns
means.
come together and say, no, this is our total budget, and then figure out what each town pays? Because then how they split it up, that's up to them.
So what happens if
Yeah.
we decide to, we either recommend or not recommend?
Yeah.
And if for some reason, when it goes to town meeting, if the taxpayers decide to not vote for it, I think all 3 towns have to vote for it. I'm not sure. But if the 3 towns vote against
Right.
it, then they have to work on last year's budget monthly
yeah.
until they come up with a new budget and resubmit it
Yeah.
And then they go back to the towns as far as
I
that
thought,
works.
I understand 2 towns have to agree. I thought all
2/3 is saying.
Two-thirds,
So
yeah.
2 towns, yes.
2 towns
So
have to
2
agree
towns.
to it.
Agree, correct.
Yeah.
So years ago, and we weren't as there were 4 towns at
Yeah.
that particular time, and the 4 towns did not get together as good as we are right now. So we're in the same boat. Everybody's paying 50% of their budget is going to the school or better. It's their highest ticket item. Doesn't
Yeah.
matter how big or how small a town it is. It's still the highest ticket item. We went to some of the meetings. They did come down some. One of the things they gave up was a librarian, which maybe give administrative out and keep the librarian would have been a little bit better feeling. But so I think that, this is my opinion, that we should try to discuss it with the other town finance committees and either select board and see how they feel about the situation. What will happen is, when it goes to town meeting, the parents and teachers will vote for it. We may look like the bad guys for trying to keep the taxes down. So that was what that's what will happen
Yeah.
if all 3 towns, or two to 3 towns do it. So just want to make everybody prepared for what can and would happen, so.
Well, the other thing too is if we said we didn't recommend their budget and the townspeople vote at town meeting to not take our advice, well, then unfortunately they're going to have to take responsibility for their increase in their property taxes.
I mean, that's what happened last year. That
Yeah,
was
we
a
did
pretty
no
significant
opinion.
increase last year.
Yeah.
Nobody batted a lash about it.
Yeah. Well, again, we're here to be an advisory board. We're here to be, the fiscal watchdogs. And again, if people choose not to ignore our advice, that's their choice.
Yep. Yeah.
But again, then I don't want to hear too many complaints about what their taxes are.
About the
going.
tax rates.
Yeah.
And the other thing that
Yeah.
concerns me is that we as a town, we should be frugal, not only with the schools, but with the town side also. We're facing many issues that are coming about because of cuts in federal aid, and Massachusetts is being targeted by the current federal government administration. But there's also something that I just found out these past couple of days ago. Massachusetts, there's 2 ballot questions that are going to be on this November ballot. 2 of them will have a major effect if they're approved by the residents or the state.
Populace.
Yeah.
One of them is the act relative to limiting state tax collection, and in that anything that's above the previous year's budget, and any type of reasonable cost growth, normally the state would put that in a rainy day fund or some type of stabilization. This act, this ballot act, would stop that and would have to rebate the taxpayers for that surplus. So that would be money removed from the state
Right.
and
Given
returned-
back to the town.
given back to the taxpayers. The other thing is there's an act to reduce the income tax from 5% to 4%. Now, according to the Boston Globe, this would cost the state, now if both of these acts go, between $4 and $5 billion, not million, billion dollars. So if these pass, this massive cuts are going to be substantial on the state. So if we're looking that the state may help us because of federal cuts, we're going to be looking at state cuts.
Yeah.
So the problem is that we're going to be, everything runs downhill and it's
Yeah.
going to affect us. So my thing is I think we have to be fiscally prudent. We must watch where the dollars go because again, if these people, if our residents demand these services, we're going to see property taxes go up pretty substantially. And I think that as a community, that's going to be an important decision for our future. Again, if we become an unaffordable community, if things for some people can't afford to live in our town because of the burden, it's not going to be a benefit to our community. It's going to hurt this town and its future. So that's why I wanted to bring that up about these ballot issues, and we all know the federal issues. So I think we need to be fiscally prudent for this next fiscal year.
Yeah.
That includes, like I said, not just the schools.
No, I think we've done, at least we had the opportunity to bring every department in here and discuss their wants and justify their wants. We keep trying to, I wouldn't say steal, but trying to cut back on the town departments to try to offset the school department. So there's a fine line right now where what the towns are willing to afford. Who knows? They may be willing to afford more. We are just seeing what's out there, what's happening. Again, with the state, we know what's happening with the federal government. We're looking at different projects that they're trying to do in a town. We're looking at a tech school that wants to build a school that's going to cost us $380,000 coming out of the town's, our town, over the next, 30 years?
Yeah.
We have a failing sewer plant that is really trying to put together a program where they can rebuild, which, the town is responsible for that. They're taxpayers of the town of Northfield. We have 2 water districts. One of them had a problem. Luckily, we had the other one that actually stepped to the plate and was able to get water to the customers. And that's a costly item. We have a EMS building. We have a fire station. That's a lot of burden for these taxpayers, and it's going to be. We're going to make some hard decisions. We're going to look at these, and we're going to say we recommend or don't recommend. And the don't recommend means we just don't want to raise the taxes for the taxpayers of the towns. It's not that we don't want these programs. It's just that the taxpayers may feel enough is enough. So we would leave it in their hands to decide if enough is enough, like you said, for them. But if they vote for it, don't blame the select board or the finance committee if we recommend one way and they go the other way. We are looking at all the big picture.
Yep.
So,
Well, and another consideration is enrollment's going down.
Yep.
It's still going down,
Yeah,
and
yeah.
even though they've opened up school of choice seats, when you bring in a school of choice student, they pay less than what
Yep. What it really
it costs
yeah.
to have a student there. So that sounds awesome for their numbers, which they can't count, but it actually causes us money,
Yeah.
right?
And
And
those
it goes
what-
in their, whatever that fund is.
The school choice.
school choice fund.
Yeah.
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 Yeah,
For them
because
to use.
unfortunately, the state mandates they cannot be charged for capital
Right,
or OPED,
exactly.
Yeah.
which means that they come in, their costs are several thousand less per student than
Exactly.
our student that's within the district.
Right.
And the other thing too is clearly they're looking to increase their student population by increasing school choice, because the numbers are clearly from in-district are continuing to decline.
Right.
I mean, Vernon, anybody from Vermont, they also have a tuition limit.
They have a
that
tuition
Vermont-
they pay
yeah.
up. They pay
Yeah.
So
more
They
than.
make
Yeah.
it sound really, oh, well, we'll just get them from other places, but. it
So,
costs
you know,
us
It's not that
money.
which-
easy.
And they're the only department whose constituency is decreasing. Nobody else is. I mean, we still have the same population for
Right, but
EMT and fire and all that, but they have fewer. So where's the,
I mean, 65 plus is increasing here. I
Right.
mean, they're all getting older, they're not having babies, and
and we still need to support those services, all of the services, but,
The years where families had more than 3 kids is gone.
oh,
oh yeah.
The average is going to be 2 as far as doing
Maybe.
that, and it's people are getting married later in life. People are moving towards the cities because there's more for that type
Yeah.
of generation is doing, and I see it with my kids. It's kind of like I see it happening,
sure.
and it's not going to change in the near future.
I'm in the same boat as Dan, but kids have left the area because, you take a look at the job market,
Yep. There's nothing here.
affordability, and, but the other thing is we're starting to see it out in the eastern part of the state where, again, because of decisions made by our federal government, Researchers, university professors are leaving Massachusetts. You're starting to see employees leave because not only the cost of living, but their jobs, many of them high-tech, very specialized jobs, which require a great deal of education and expertise or knowledge, are leaving. And that is a warning sign. You know, I mean, that's, all these things, like I said, overall concern me. And then again, I'm looking at figures of a declining population overall in Northfield over the next 14 years.
And when was the last time you opened the paper and did not see that a school district is struggling?
Yeah.
You know, every time. And so what are they doing or we can do to address it in a more constructive way? They're not. They just
Well,
want to
no,
maintain
the only way
themselves,
you
and I
can,
get that, but
you can do that
it's
is
impractical.
somehow, I mean, why is the tech school thriving? Okay? Because they're drawing from 19 towns.
Yeah.
And so when people start talking regionalization, you've got to really start thinking about that. 1 or 2 or 3 towns cannot support or not be supported
No.
and not get the education or the embellishments and all the things that go with education that draw people to this part of the country or this part of the state.
Exactly.
Yeah,
I don't know. I mean, this we could go on. This is really
Yeah.
getting, you
I
know.
mean, we're all like-minded, but
Yeah, I know. Are private schools locally around here struggling with the same thing too?
as far as I know, no.
They're just bringing people in
Okay.
from all over the world.
Yeah, because
Yes.
like
Being one of the younger people in here, and are you seeing that trend? I don't know. Yeah.
I mean, I moved here from like a West Coast city, so I have done both. You know, there's goods and bads about all of them, and I think that what I am noticing for sure is the income disparity of communities is right. Like you've got
Well,
these
definitely.
folks who make so much money, and you've got these folks who are on a fixed income or just don't make a lot of money, and we've lost that middle bit. And so it's these folks making it expensive for.
It's tough unless we get some millionaires moving into the town.
You know, I do know, like outside Augusta, Maine, there's a private school called Erskine Academy, and they not only have boarding students, but they've taken in the kids from like several towns. I think Vassalboro, China, and they can go there since none of those towns have a high school. They can go there, and the town pays the tuition.
Well, it's like I told Leiden, you know, it gets down to with their population of their town, if they don't have that many students to go there, it would probably be better for them to tuition them to wherever the kids wants to go.
Yeah.
I mean, you know, that's a typical small town that is moving that way, I think.
you've got to look ahead. You have to look
So,
ahead.
That's
but
why,
we
that's
yeah.
why the state's encouraging regionalization. It's not just us saying
Yeah.
this is, you know, what is that, Mohawk, or was one of the districts is looking to increase, you know, through regionalization, because
Yeah, they are.
they're, you know, again, we're not picking on PVRS. PVRS is just a symptom of a larger problem. They're
have the
all
same
suffering
challenge.
student loss.
Yeah.
The thing is, how do we combat it? How do we deal with it?
Right,
And the only common sense thing is regionalization, open it up to more communities and working together to try to keep the school system operating. Because again, how small do we go until we get to what? You know, and the costs are not
That's the
going
birth
down. I mean, everybody thinks, oh, you have less students, should be less cost. Well, that's not happening. The budget's going up substantially, but the student population is still continuing to decline.
I would love to see 4 or 5 superintendents from around the area here in the same room and ask them how, you know,
Yes.
you know, what is it? They're looking at the same problems we
Why
are
do they
seeing.
not do that? I can't for the life of me figure out why they don't do that.
Job security, maybe.
Well, I know, but that's.
But that's not
Well,
the
I
way
understand
education
that,
should
but
be done.
No,
I know.
because their goal is to educate the kids,
Exactly.
right?
Exactly.
Yeah, and that, yeah. No, I get it.
Yeah, Durns Falls, Greenfield, Pioneer, take a 20-mile
It's a good
radius
break.
or something like
Yeah.
that. Sit down and come up with a plan.
It's gonna break.
I mean, utilize each one's, kind of work out a program.
Right. Well, and that whole notion of, well, this can be solved by writing to your congressman to get more funding.
Well, what he's saying,
There isn't
that's
gonna
not
be
that's not going
any.
to happen. So you
There
got to
isn't
kind
any,
of
you know.
hone
No, there's
hone-
finite resources. I mean, the
Yeah.
state has many challenges. We have our state needs infrastructure replacement, improvement. There's so many demands being placed on the state, and the federal government is requiring more and more of the
Right.
state to take more responsibility, pick up the tab in that, and it's just, there has to be.
What's their breaking point?
Yeah. I think the only thing is, if we do, no matter what we do, recommend or not recommend the budget, we have to have a clear reasoning why.
Yes.
Yeah,
And I think communication with the other two communities is advisable.
okay.
How do
So
we-
that said, maybe we can reach out to the other two towns.
Okay,
Yeah, can we
maybe,
set
if
something
so,
up?
I'll try to look at my old emails and see if Jane,
Yeah,
and see if Jane has,
because they're into their budget season too, and they're
yeah. Maybe
they
if I can
they
reach
have
out
just
to
gotten the
Jane,
budget
yeah.
from the school, and they'll
Yeah.
be fresh off the
Yeah.
presses, and we can sit down and
Yeah, see if I can
it's
find-
usually okay. Come annual town clerk or
Yeah.
town meeting time, they throw it up there and say everybody votes
Yeah.
for it. Nobody has questioned that because you can't, because there's no line items that you can actually say, hey, how much is this
Yeah.
person getting? How much is this person getting? So, but
Yeah.
This goes back to Bernie, his statement of we need to give some
good.
really clear reasons and not just say we don't recommend it. I
Right.
think we need to read so that
I
it
think we
helps them
brainstorm
more.
on what we would be saying. And
Absolutely.
who wants to say it, I don't care, but I'll be on over on the select board side, so.
I agree. I think that regardless between the omnibus and the school budget, we need to make. I feel it's important that recommend or not recommend that there is some verbal input from the finance committee for how we have come to this conclusion and what kind of questions we have been
I
asking.
think we do that once we talk to the other towns and
Yeah.
see what their
idea.
feelings are. If they're saying, well, we're going to go with it, then that kind of leaves us out hanging out here. So
It's okay, then we know.
yeah,
I'll try reaching out to Jane and see if they're doing anything and at least getting a consensus with the
Yeah.
three towns, with
Yeah.
the,
Yeah, if we can get together and
get
actually have a
together,
conversation.
have
I
a
think-
conversation,
I
maybe
think that
come to a
helps.
consensus on what,
because it's the biggest
Or
part
just
of every one of
understand
their
where-
budgets.
Where they're coming from,
Yeah.
yeah,
what they're feeling.
yeah.
Okay.
And, let them know we're supportive of them because we know they're getting
They're
nailed.
getting nailed.
Yeah, okay,
Well, we are, but they are.
yeah, okay, so we all set with Pioneer for right now?
Yeah.
For now,
Yes.
yeah, I think that's
Okay.
a good idea to
Okay.
try to reach out.
Do you guys want to start reviewing the budget?
No,
We don't have all the information yet on that, I
Okay,
don't think.
okay. Is anybody you want to bring
Great. Did I say
back?
We
or-
still have a couple more, don't we,
Right,
to
right.
come in?
I
got
would probably
police.
review the budget. Once we finish,
Okay.
everybody's in, and
Yeah.
then we go start from scratch
Right.
again, and we go through all of them. That way, it's more efficient, and that it's fresher in our minds.
Yeah.
And again, I don't want to start, like I said,
Okay.
reviewing when we still have department heads
Okay,
coming in.
and
I like doing.
I know
all
we've
at
got
once.
some
Yeah.
capital requests that we're missing information.
Yeah, then we'll have everything plugged in,
Okay.
we can look at it, we can say,
Okay.
okay,
We can make
Okay.
some clear
we
cut.
can actually look at, what I want to do is look at everybody's budget and see what's the percentage that each of their budgets have gone up. And then maybe if someone's gone up more than we think,
Yeah.
we bring them back in.
Yeah,
Yeah,
exactly.
okay, fair enough,
Then we'll have the whole.
yeah. But I think most of the town budgets were basically salaries, maybe some minor supplies.
It was salaries and insurance.
Health
That's
insurance would
Health
really be
insurance.
We gotta beat
drivers.
up hard on.
Yeah,
We don't have that many capital projects that I see.
No, I think
Okay.
This is what-
way less than
yeah,
last year.
it is.
Last year we had
Well,
a
some have
lot.
been already withdrawn before they were even
Right,
presented to
right.
us according to their capital request list there.
has she plugged in retirement, the retirement assessment? Let me see if she's plugged that in.
I hope you, I'll get my retirement.
Other insurance, retirement, that's usually,
No,
okay,
Again,
that's
we're
gone up like 13,000,
no,
so
that's not,
not too bad, I
not a
mean.
lot.
No.
That's
No.
enough for you. That's
No, not too bad, so
That's-
if that's,
Don't be
yeah.
greedy, Dan.
okay. Otherwise, I have to still be on town clerk.
You can live off. Live off Sandy.
Okay. So we'll wait on the town budget.
Yep.
Okay,
That's a good idea, isn't it?
briefings on meetings attended by others, any,
No, just, we already took that. School.
okay. There's no public here.
No public.
I didn't see any correspondence in the box.
Does anybody have a calendar? I can look one up here. Let's see, I think what's coming up next, that's all.
Yeah.
So our next scheduled meeting is on the 9th.
9th, and the police are coming in at 6. The Council on Aging wanted to come in at 6:30. Do we need anybody from sewer back here? Are we okay?
No, they just,
Okay.
yeah.
We probably want a little more information before we bring, well, Matt's got to get us that capital stuff.
Yeah, Matt has to get
Yeah.
the capital stuff, because again, the police chief, you
Yeah.
saw, he gave us a long list of, for his quote for his replacement
yeah.
of his cruiser. I think we need the same, you know what I
Right,
mean? Treat every
right.
department the same.
Yep.
And it just needs to be, it's just like forgive me, about the issue of the transfer station. We need to see, we
Yeah.
can't have pie in the sky or, you
Yeah.
know, this is what I think it's gonna cost.
Yeah, we need some concrete information.
Yeah.
We need
Any-
concrete information, basically, what's needs to be done. These are quotes I've got, this is the general idea of what, you know, that it's
Yeah.
gonna cost. And, you know, we just need more details.
Yeah, we want, if we can, get more than one quote.
Right.
Yes, absolutely.
Were they going to hire somebody to do that decking, or, okay.
We
I
did
didn't-
not
I-
get that information.
Okay.
And again, there was.
I hate having a
that's why I asked
volunteer to
for-
set it up.
I asked for more specifics. Those are
Yeah.
the things we need,
Okay.
because it's not a small amount of money that they're
No,
seeking
no.
either. So I think that's, I
he
think
didn't-
hopefully
yeah.
Andrea can get that information, or
Right.
have somebody, a representative of
Yeah.
the either transfer station or the health board come before us and brief
Okay.
us.
And what was it? The cameras, there was no quotes.
There was no quotes for there was no
Well,
idea.
that should be easy to get.
Yeah, there was no
Yeah.
quotes on there was 3 items they were asking for, and there was no quotes for any of
I
the
thought
3.
they withdrew one of them. I thought it was the cameras.
I think they withdrew one of the compactors.
Okay.
Yes.
Okay,
Yeah,
okay.
that was one of
Yeah.
them.
No, yes, there's only 2. Was
The
the decking
decking
and
and
the
the
cameras for a
cameras.
total of $25,000. Again, we have to be fair. We got, like I said, we need more details.
Right.
You saw that I requested Andrea to get that information to provide it to us and
Okay.
a revised budget.
Okay.
Yep.
Okay, so then there's items not reasonably anticipated within 48 hours. Nothing, and
The 9th.
the 9th, yeah, 9th, I said police. You guys, anything in particular you want to talk about after a council on aging, or?
You want to do the bylaws and get that out of the
Oh,
way?
yeah.
That's
Yeah,
the other
that's
thing
what
is-
was, we were thinking about for the 16th, but we can do that.
You wanted me to move it to the 9th?
If- I mean,
Okay.
if we're gonna have time, we might as well.
Yeah,
Yeah,
we're waiting,
no.
yeah.
It'd be efficient use of time, and then the next meeting after that, we start reviewing all the budgets.
Okay, okay,
Sounds like a
Because like
plan.
you said, we're already into March.
Right.
It won't be long before town meeting.
right. Okay, so we'll do the bylaws after council on aging. Okay.
So I am out of town on the 9th.
Okay,
So if you would prefer, I could watch the recording afterwards,
okay.
or I can phone in, whichever is easier for everyone.
Okay, if you have any comments, because you've got the bylaws, right, our proposal?
I already sent what
Okay, you made your
unless-
comments?
Yeah.
Okay,
I think we're pretty close on that, really.
Right.
It's just a matter of just
Right.
reviewing it and, yeah,
reviewing it, and then we
submitting
can
it.
send a final document out.
So I can make an article, yeah.
Yeah,
Okay.
I make a motion that we adjourn.
I second Gail Weiss. Is there a vote?
Any discussion? None.
Nope, any discussion to adjourn? No?
Nope.
Gail Weiss, yay?
Dan Campbell, yes.
Bernie Parada, yay.
Morgan O'Brien, yay.
Lindsay McCarthy, yay.
Robin Vanderbat, yay.
8:05.
8:05.
Good night.
8:05.